Now let's go ahead and place some solid filler smooth PDO threads to really pop out these vermilion borders, which look great because of the techniques we've already used. But now this will make it super crisp, because imagine if you could take a solid piece of filler, put it exactly where you want. That's what you're doing here. Plus, with a PDO thread, it will build collagen over time. So we are using a 29 gauge by 30 millimeter VSoft lift smooth PDO thread, the best ones on the market. They produce the most collagen and they give the most support right when you place them in. This is all about getting the right certification training by the AAFE, so you place these in the right plane. That's exactly what this is about, is placing these in the right plane. And if you have some experience, the AAFE has some live virtual certification training, because you can learn to do this with a virtual hands-on experience that we have. But if you go ahead and follow the vermilion border, then you will get this immediate crispness that you will add with the dermal filler that we added with the right angle technique, as we used micro droplets as we came out of the vermilion border, if you remember on this case here. But we are going to put, this takes only about 5 smooth threads to place in there. But you want to grab the tissue, know exactly where the tip of your instrument is at any place. And as you go ahead and place these to place, and you don't necessarily have to go all the way in, there's a little loop at the end of these smooth PDO threads. As you can see, we're going to go ahead and get it to place in the right plane, the subdermal plane. Turn it 360 to engage that loop, pull it out, and then it stays in the tissue. And it will really go ahead and define that vermilion border better than any dermal filler can ever do on its own. And that's why this is the perfect third leg of the triad of Botox fillers and PDO threads to really get and accomplish so many things. But certainly when it comes to vermilion border pop, that's what we are using this for here. And patient is fairly comfortable here. As you know, from the ComfortDocs BLT that she had before, but from all the dermal fillers in there that have its own lidocaine. So that's why we place this at the end. We like it better at the end. There are some people that place it at the beginning before you place the dermal filler. We really recommend placing it at the end so that you can go ahead. It doesn't get moved around at all by any other injections here. So we really go with this technique better than trying to place it to begin with. That doesn't make a lot of sense to us there. But here we go, and really let's get the bottom of that pout, the vermilion border of that pout, and we just kind of massage the tissue as we get this to place. There's no hurry. It's about the technique. It's really about being in the right plane for all of this. And you can see 360 turn comes out, and that stays exactly where you want it. Now has really popped everything out here. Let's take a look at the before and after from the beginning of this procedure. Look at this no swelling double pass technique with all the different techniques we talked about. Gorgeous lips. We've got some added lip height. We've got some beautiful projection here, as you can go ahead and see. We've gone ahead and just put a thin layer of lip cream or Vaseline on afterwards here, but that is mostly filler what you're looking at. The tiniest bit maybe of swelling that will literally disappear in an hour or two. So gorgeous lips is in your future and in your patient's future, so make sure you use the AAFE techniques and get AAFE certification trained today.